So welcome to exam one review for the PNR 204. I am Professor Bogart. I am your lead pediatric instructor. I'm always available for you for anything you might need. One of the things that I do help students with is dosage calculations. I will again post it to my review recording so that it will go out to all of you to look at. I have handouts with it, and it does make things so simple. And if you're still not understanding, just please ask for help and we can get together and I'll help you. You don't have to be my student in my class, okay? So just for you to be aware, I make it easy. So let's go ahead and let's start, with our review. So there's a lot of chapters that we're going over, and I know it can be overwhelming. So let's break it down into what we really need to understand. Well, in pediatrics or any sort of, courses you're in, there's always going to be a list of vocabulary that you need to know. Cephalocaudal, which means head to toe. What does that mean? Well, the first thing an infant does, they lift their head. Then they turn from front to back to front, get on their knees, they creep, they crawl, they walk, right? That's cephalocaudal. Now, proximal distal means that our hands are here first doing things, and then we reach out and start grasping outwards. So it starts with proximal, which is close to me, distal, which is going outwards. General Pacific means the ability to perform general physical functions. It's, we can look at the pulmonary system or we can listen to breath sounds. So is it specific breath sounds or is it just telling me how we're breathing? Maturation is the total way in which a person grows and develops. And it's dictated by inheritance. It's what did you get from your family, right? Growth is the way you grow, physical, height, weight. Development refers to the progress, increase in the body's function. And that could just be that turning over, walking, crawling, walking, then running, hopping, skipping, jumping. That's all of development. It means whether it's cognitive, understanding, or physical. Hereditary, it's a factor that develops maturation. It means how are you going to grow is affected by your heredity. Nuclear is a type of family, and that's traditional. You have a husband and wife and kids from that husband and wife. Blended is when you have two families that come together. So you have a husband that had his own kids and a wife that had her own kids, so they come together and it's called a blended family. Alternative refers to communal families. And sometimes that's a group of families living together, sharing costs in a commune, but maybe under one apartment roof. I mean, with a lot of expenses today, that's not uncommon as we might think it is. Extrusion reflex. So you start to feed that little infant and you put that rice cereal on because it's the most tolerant, less allergies have been seen by it. And we put it on their tongue and they protrude their tongue, protrusion. They don't know how to swallow it yet. They're only used to sucking. So it's called an extrusion reflex. They take their tongue and stick it out. The grasp reflex starts with mommy puts the finger in and the baby by a reflex just grabs a hold. They didn't know they did it. It just happens. As they get older, then they voluntarily, by about 3-4 months, they'll grasp that rattle by themselves. It's not just a reflex when something touches that hand. Prehension is the ability to grasp objects between the fingers and the thumb. It's sort of like a pincer. It's a pincer grasp. Whether it's crude at first and then it becomes very fine, that is what that's called. A parachute reflex usually happens when a kid, is about 6-7 months old, and they fall, and they put their hands out. It's just normal. What do we do when we fall? We put our hands out to brace for the fall. We know that that's going to protect their heads, but we also know that sometimes they can get broken wrists because of it, fingers, because they are actually protecting their head, but it is called a reflex. Negativism is the toddlers. Toddlers ages 1 to 3, they're always saying, no, 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 me do, mine, mine, all negative. It's no, no. Ritualism is being on a routine. They like certain rituals, especially your toddlers. Toddlers absolutely need to understand what is coming next. They're happier and they can work with what you want a lot better by knowing what is going to be coming next. Personality is, what are those characteristics that shape a person's behavior? Are they happy? Are they sad? Are they always crying? Are they always angry? Even babies have personalities. Parallel play is when two children, and this is very common in toddlers, they're playing next to each other, but they're not with each other. Okay, I have my toys, you have your toys, right? Toddlers don't share. Mine, all mine. They're playing next to each other. And that's all that parallel play means. And then egocentrism, again, this is your toddlers mostly. And they don't understand anybody's view but themselves. I was playing with that toy. He took it. It's mine. Rip it out of their hand. It's mine. Now, Freud's all about psychosexual. From oral, they explore the world through their mouths. Don't infants do that, right? Plus, they like find their finger and suck on it and they're like, oh, this is good. Or that pacifier. Anal is when they start that potty training because they do bowel training before bladder training. They can hold their stool before their bladder. And then it goes into the preschoolers, phallic. They're more of playing with themselves, exploring things, but also Freud says girls like their daddies better and boys like their mommies better. It's just part of, normal way of being. Now, when it gets to be into the school age, we call it latency. But latency is more about these children now want same-sex peers. Before this, they weren't as much interested in friend as much. They had kids at school they liked, but in school age, then they're going to have their friends. And it is same-sex friends. And then after that, you get into adolescence. This is the genital stage. This is the adolescence, and they want the opposite sex if that's who they want. So breaking down Freud's stage. So Freud's stages of orality in which an infant explores the world through their mouth. Whether what? Stick their thumb in, rattle in, toys in, blankets in, anything in the mouth. This is what they do. Anality corresponds with the toddler stage and involves learning to give and take by saying no, right? No, no, mine, mine, mine. It's that egocentristic type thing too. The phallic stage corresponds to preschooler becoming aware of their self as a person, sexual being. And then, of course, as I said, girls like their daddies and boys like their mommies. It's just part of what they say. And then Freud, again, same-sex peers. They want their same-sex peers as their friend. And remember, this is the breaking out of the house into other people besides just family. Now, Piaget is all about thought. It's all about taking something small and then developing and making it bigger. Like you're an infant. All of a sudden you start, your thumb finds its way in the mouth. You didn't try to do it. You didn't know you'd want to do it. But all of a sudden it's there in the mouth and you start sucking on it and you go, wow, I like that. So they start sucking their thumb. Sensorimotor, really? Their mouth. Also, this is the age where they see something, a toy, and it gets hidden for whatever reason. Mommy hides it behind something because you want tummy time to try to make them move to go find it. But even if it's not out in the open, they've seen it. They know it's there, and they go actively searching for it. Now, pre-operational is now when you start with that imagination. This is when you start having children taking brooms and riding them as a horsey, or putting their arms out and being airplanes. It's like they start developing their own imagination. They also, with the end of the pre-operational, look at conservation and more into the school age, I would say. And conservation is not conservation like we would think. We know that if we have 10 pennies on the floor, and whether they're lined up perfectly or they're scattered all over, it is still 10 coins. Younger kids don't get that. It's then they start about 7 to understand that this is still the same thing, okay? That there's still the same amount that are going to be there. Concrete operations, again, they're starting to understand more about their situations and why they do things, and they're starting to be more rational about stuff. And then formal is when they really can put everything together. I call it the adolescents trying to tell a story on how to get things they want when mommy already said no. And then they start doing all of these things and thinking about what to do. I'm going to get an A on my test. I'm going to make my bed, put my clothes away. I'm going to take the garbage out because I know if I'm that good, maybe mommy will let me go, right? That's part of formal, really thinking hard how to get what you want. Now, Piaget, I've already said Piaget 0 to 2 is about the thumb, about the rattle, wiggling. Pre-operational, the beginning is that playing with that stick, the broom, being an airplane. It's even taking that sippy cup, throwing it on the floor because they know why mommy's going to come and is going to pick it up because they wanted mommy. That was why they did it. And then concrete operations, they're starting to be logical, as I said. They're starting to understand, why did I get sick? Well, I was out in the rain yesterday. That's why. Why did my dogs die? Well, he was old. He had cancer. And then why do pigs not fly? Well, they don't have wings. They're starting to figure these things out where at an earlier age they could not. And then I told you formal operation is really more sophisticated and really more trying to get what their needs are. So Erikson, these are the different things we talk about Erikson. Well, the first one that we're going to talk about is those infants. Now, infants, all they do is cry, and mommy comes and picks them up and needs are met. And that makes them really happy babies because somebody's going to get them if they cry. And that gives them hope. But what if mommy, daddy, nobody picks them up? They sit there and cry, 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 cry. Well, they're not going to have that hope, and they're going to be unhappy children. As we get older, we get into the toddlers. We talk about autonomy versus shame and doubt. What is autonomy? I'm autonomous. I myself. I want to do by myself, me, mine, right? So these kids are exploring like crazy. But mom, dad, grandma, grandpa, whoever are saying, be careful, watch out, don't do that, don't jump, you're going to get hurt. Where they need to learn how or to try things as long as they're not going to get hurt, okay? So these children, their will is there, that they can do things, that they go out and search and seek to do stuff. Now, initiative versus guilt is in the preschoolers, and they really talk about doing things for others, thinking about others, and then feeling guilty when things happen to people. And that's the purpose. As we get older, school age, very important one, industry versus inferiority. Well, what does industry mean? Well, industry is what a school age child can do well. Is it writing, spelling, math? Are they good at sports? Are they good at musical instruments? What are they good at? That's their industry. I feel great. Great self-confidence. I feel good. Now, what does it mean by inferiority? Well, that's all the other stuff they can't do well and they feel inferior for because they get no confidence from that. Maybe they're good at schoolwork and not a good athlete. could be. So when they're outside, on recess or gym, whatever, they're not doing well, they feel inferior. And then the last one we'll talk about with Erikson is when you get to be an adolescent, identity versus confusion. Well, when you talk about identity and you talk about adolescence, this is where they're trying to figure out who they are sexually, who they are going to be when they grow up, where are they going to fit in, who is their peer group. They're looking their body image. What do they want to look like? Do they want short hair, long hair, curly hair, straight hair? It's body image, identity, my sexual being. Who do I like? Girls, boys, both, none? Who is it? And then that what we call the confusion is trying to figure it all out and making mistakes and, keep trying to figure those things out. So again, let's go back to Erikson. Infants, trust versus mistrust. It's a development of a sense of trust in the infancy, and this gives them that personality. They're happy, they're healthy, right? They don't have anything to be worried about, so they're happy. Toddlers, they are learning how to do things. They're learning how to dress themselves. They're learning how to go to the bathroom. They're learning how to feed themselves. And this is all part of being autonomous, all about me do. And then I said those preschoolers, it's all about, trying to be that good, understanding that, and then feeling guilty when somebody's hurt or they can't help someone. And then again, remember school age, one of the important Eriksons that you see on many exams and Klex's essay all the time. School age, industry, what is it? What do I do well? Inferiority is what I can't do and want to do that for it. So it's all about feeling good and getting that recognition for the stuff they do good. And as I said, those adolescents are looking for who they are, where they're going to fit in today's society, and all the confusion that goes with it. So Maslow's hierarchy of needs, we know it starts with you need food and clothing, and you need, where to sleep, right? You need a home. And then it keeps going up. Your physical needs are met, then you need your safety, and then it goes to being loved and belonged, right? And then, in the end of it, how do I feel about me? I need to feel good about me. And it starts with the bottom layer being done. As it goes up, all of them are met, and then they feel good. Now, Kohlberg, stages of moral development, morality. Morality is good or bad. And then we know it's also a punishment or a reward for good or bad, right? So when they're really young, they have no clue what this means, none at all. We know that it gets into that toddler preschool area. It's all about me, mine. And they're actually want to look for rewards. I've been good, so mommy gave me a piece of candy or a cookie, or mommy did something. They're wanting to do good. Now, as we get to be a school age, they know right and wrong, but they're looking for approval, so they want to be good. They want to be friendly. They want to do the right things. And those are the ones that we talk about. As it gets older, we know that the adolescents are more into doing the right things. It doesn't, it's my morals. I want to do the right things because I want to please and I don't want to get in trouble. So the infant, let's talk about some of the things that we need to know. Well, a newborn for the first 28 days, up to 4 weeks of age, they're called a neonate, okay? After 28 days or 4 weeks, 1 month, they are called an infant, up to 1 year old. And at 1 year old, then they're toddlers, right? So you're going to hear some terms with neonates. That's the very, very young infant, 28 days or less, or infants up to 1 year. Now, how do infants grow during that first year of life? Well, if they're born at 7 pounds, by 6 months, they're going to be doubling that at 14 pounds, and they're going to triple it by the end of 1 year and be 21 pounds. And they're gaining 1 inch per month for the first 6 months. They're growing like crazy. So an infant should be about 29 inches at the end of the first year, which is quite tall. What else do we know about that first year? Well, about age 1, they should be standing and attempting to take a step if they're not already walking. They should be almost there. And I've said it doesn't matter if they can fully walk yet, at least they are attempting and they're standing up. And then their development is perfect. Many children never walk. My grandson, my children never walked till 15 months, and they ran. There was never a step. There was like 28 steps. I said, well, that's what you call running. That's not walking at that point. And about 6 months old, you're going to see teeth. Doesn't mean all kids at 6 months are going to get teeth, but that's what they're saying. It's about 6 months that you might see the first ones. Now, for the first 6 months of life, what do babies eat? Well, it's either breast milk or iron fortified formula. Now, what is the best food choice to start with after 6 months? We can start introducing solid foods. Well, rice cereal. Rice cereal is the easiest on the stomach. It tolerates it well. So we should start with that one. And that's why, because the body tolerates it better. Remember, even if we're giving foods at 6 months and the GI tract is supposed to be already mature enough, it doesn't mean you still might see some of that food in the stools. Like you might start feeding them carrots and you see carrots in the stool up to about a year. That's absolutely normal. But that's not meaning they're not tolerating. You know, you would introduce one food every 4 to 7 days and start out with the rice cereal. And an allergy would be a rash. It could be intolerance, vomiting, diarrhea. Those all could be what we could see as an allergic. Not really allergic, it's called an intolerance to the food. Now, breastfed babies is what is the best for the baby, but iron fortified formula is just as good because some parents can't breastfeed for whatever reason, and they shouldn't be made to feel bad because they can't. Now, some parents, when they start to be able to feed their infants at that second 6 months, they want to make their own food. Never add salt or sugar. No honey before the age of 1, actually age of 2. Honey can be contaminated and cause botulism in infants, so we don't want that. Hardly any water. We want all nutrition because water is empty calories. And you should strain or puree the food, and you should put them in little ice cubes. And then what you can do is, you know, that little ice cube tray, you pull one at a time, and that's all they need. It's only 1 tablespoon per year of life. So that's 1 ice cube. So we're doing good. So not a lot of water, no salt, no sugar, strain it, puree it, put it in ice cube trays, and 1 tablespoon at a time. So the sense of trust, we know, does help a child to be a healthy personality. We know that sensory stimulation is important. You know, that's why we looking at those children and figuring things out. And that's Piaget. Remember, senses and the way that they're thinking, it's all Piaget. You know, showing them that rattle or putting them tummy time and they're looking at these things and grasping things and object permanence and looking for it. Sometimes you have an infant who's what we call lethargic. They don't move as much. They're just not as active, and it can happen. So one of the things is, how do we as healthcare professionals work with them and teach the parents of these infants? Well, number one, don't have bright light, sunshine in their eyes. They don't like it. You should talk easy, gently, calm, and slowly move that child. And then have that child just sitting up to be able to look around. And that actually gives them comfort. They feel secure because you're not rushing anything. So slow and easy is what you should do. Health maintenance visits are essential. Why? Well, what do we do with infants? They're born, they get to the doctors within what? The first 2 weeks of life, and then 2 months, 4 months, 6 months, 12 months, 15 months, 18 months, 2 years, immunizations, right? But what else are we doing there? Well, we're weighing them. And what does a weight and a height tell a healthcare professional? Is that baby getting proper nutrition? So very important, if we're seeing a child not gaining, that we look at that and we educate those parents and support them. SIDS death is when we put babies on their tummies to go to sleep. Or we have things in their bed, some blankets, pillows, bumpers. These things can smother these babies. I've watched the research done on SIDS for many years, and they've changed a lot of things about it, but they said today on their back to sleep, and there's less incidence of SIDS death. One of the things parents might complain about is their head getting flat, right, on the back. Well, infants' heads are soft. And because they're soft, when we put them on tummy time, it actually allows the head to round out, and it doesn't make that head be flat in the back, because it's one of the concerns many parents has. One of the other things that we need to be concerned about is getting these kids home from the hospital and how they're going to be in a car. We know motor vehicle accidents are one of the biggest things for unintentional injuries in all age children. We know that's it. So how do we take care of infants? Well, they should be, for infants less than 2 years old, should be rear facing in the rear seat. And they should be weighing but less than 22 pounds. They also say, put them in the center. Many of us put them on the side, usually the passenger side, so you can turn and you can look at the infant, right? Well, the research says it should be in the middle. Remember, they should have their harness on, and it should be anchored with a car seat, okay? Very important. Now, many mothers like to use those slings. Just be careful that they can breathe, that their mouth, their nose, their neck isn't crunched, that they're able to breathe properly. So one of the things with toddlers is at age 1, we start having milk, whole milk. And we need whole milk because the baby needs it for their muscles and their central nervous systems to grow correctly. So feeding a low-fat diet before 2 will affect the growth and development of these children. We know toddlers are ages 1 to 3. Their birth weight triples at age 1, right? Well, it's 2.5 years old when it finally quadruples. As they get older, they are going to be able to do more and more. Remember, fine motor skills are F fingers. What can they do with their hands? Whether it's grasping, whether it's putting blocks, into a container, taking them out, making a tower. This is all about fine motors, fingers. Gross motors is all about movement. This is that crawling, walking, jumping, walking upstairs, hopping, skipping. That's all gross motor things that we see. Now, the digestive volume and processes of a toddler increases to accommodate those 3-meal-a-day schedule. They do 3 meals and there's usually snacks in between, but their GI system's getting a lot better and it's able to absorb and to use those nutrients. The bowel and bladder control is usually about 2.5 to 3-year-old. Doesn't mean if they're delayed that, it's anything bad as long as they're attempting to try. So Erickson, toddler, that's autonomy, doing stuff myself, And then overcoming mom and dad and somebody saying, be careful, don't do that, you're going to get hurt, because they want to try, but they're told not to. And that's that when they feel that shame and doubt. The most evident of cognitive achievements, it means thinking, is to be able to express themselves. They can express themselves with a language and understanding, knowing that toddlers understand more than they can express in a language, okay? They're getting very independent. There are potty training. Again, as I said, stool training is before bladder training. It just works better. They are, again, getting more and more independent. They're able to walk better. They're able to do things more themselves. And as they continue to grow, their speech is going to get clearer, and there's going to be more and more words. There is separation anxiety, and you do have one of your discussion questions all about protest, despair, and detachment. And it starts out with screaming and yelling and crying, I want mommy, mommy, mommy. And then they realize they're not coming, and they sit there and they like depressed in the corner, maybe regress, suck their thumb, could be. And then mom comes and they're like, I don't want to be bothered, because they weren't there before. So those are 3 stages of separation anxiety. It's hard for parents to work with toddlers because they are in that stage of no, 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 me, 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 mine, mine, don't like their brothers, throwing themselves on the floor and having temper tantrums. What do you do for a temper tantrum? Well, you leave them right where they are, unless what they're doing is going to cause them harm or hurt them. And then you could intervene. But they throw that temper tantrum because they want your attention. You don't give them the attention, they won't do it again. And how do we teach discipline? Well, it's timeouts. Again, 1 minute per age of life. So preschool, we're trying to get them ready to go to school. We're trying to have them be able to be potty trained. They have to be ready to communicate effectively. They have to sit for a period of time. They have to have a good attention span, and they're going to be away from mom and dad, right? So they need to know how to accept that. Their gross and fine motors are continuing. We're just walking good and walking upstairs and maybe throwing a ball as a toddler. But when we get to preschoolers, they're running, skipping, jumping, coloring within the lines, taking fingers and buttoning shirts, all of those things. Again, preschoolers is all about that symbolic thought process. That is taking that stick of the broom and making it into a horsey, or putting the arms out and being airplanes or whatever. It's that symbolic. That means using something for that, whatever they're trying to be. Kohlberg is all about moral development, and they're starting to understand somebody else besides themselves. They see mommy not feeling well, they might go into their bedroom and get their favorite little blanket and bring it out to them and say, here, mommy, feel better. I mean, in the words that they can say. Their language, as I said, is getting really quick, really rapidly. That's why we should speak to them in complete sentences, not baby talk, because they do a lot of imitation there. These kids are playing, 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 playing. As I said, your toddlers are more in parallel play. As you get into preschoolers, these are more about cooperative play and imaginative play. And this brings a lot of socialization between other children and sharing and making something together. One of the things that these children is those temper tantrums or those outbursts, social issues, they're getting better at controlling them. Not like a toddler, they're understanding more that sometimes they have to wait, whether they want to or not. Some of the concerns parents has is, how do you set the limits? How do you tell them what they can or can't do? And how to handle jealousy of a sibling? And what if they are sucking their thumb? Well, we know that they're sucking their thumb. We want that finger out of the mouth before those permanent teeth come in, because we don't want to have braces or those teeth there. And we know this is an age about the phallic and their knowing that they have these body parts and they touch them and it feels good. It's part of masturbation. And parents should just say, you want to do that, go in your room. It's a private act. Be by yourself. It's okay. Looking at enuresis or pee in the bed, bedwetting. Some kid who has never been dry, we know that that's just something they're going to end up outgrowing after a while. And there's certain things that can be done. But if it starts all of a sudden, you need to find out why. Is it a urinary tract infection? Is it diabetes or diabetes insipidus? A lot of different conditions can cause it to occur just suddenly. School-age children is now they're getting more independent. Many of them are latchkey, right? They can come home from school, open the door, go in, get out of their uniforms, get a snack, do the homework, and go in the backyard and play. School-age kids can do that, and they really need to be given some of that responsibility. As I said, Erickson, industry. So what is that stage of industry? What I do well, right? Inferiority is what I can't. Freud describes these school-age children as sexual latency, and again, this is same-sex peers they're talking about. Piaget is now understanding the relationships of things. Remember, Freud is all about something sexual. Erickson is about doing something physically. Piaget is more about the mind and thinking and learning and building upon it. It's understanding that 2 glasses of water in different shaped cups poured from one to the other are still the same amount of fluid in these same cups. Younger kids don't. Their growth is slowed during the school age, but they can double their weight during school, double their height in the school age. Remember, they are 6 to 12. That's 6 years that they're working on. School's important. It's starting those kids socializing with other children. They have to get along with other kids and group acceptance. They do need to feel important, have a self-concept that they do things well and that they can do things by themselves and they're accepted. This is almost their industry again there. Again, peer ranges. Peers are same-sex friends, and then up to almost adolescent, then you might get the opposite sex friends. Their language, of course, is developing. They're learning, they're becoming smarter and smarter, and they can communicate a lot better. Sometimes they use words and they don't know what it means. My grandson, he's now 6.5, so he's a school-age kid. He goes into the pool and jumps in. He goes, "That's my aerodynamics." Well, he doesn't really know what aerodynamics mean, but he's using that word because it's a really cool word. Moral development, again, they are understanding rules and they know right and wrong. Again, they want to please. Kohlberg, again, is talking about adhering to the rules to do right things. At this age, they might go to the store on the way home and, the 7-Eleven, and some kid steals a candy and you're like, "No, I'm not doing that," because they don't want to go against the rules. They want to do the right thing. Team sports is really important. Again, team sports gets them a feeling of working together. How would you address a child who's having some problems with focus and attention? Well, number one, try to follow them, see what's going on. And, they might need some sort of help. It might be an ADHD thing as it goes on. And again, there's always a school nurse that can help you with those things. So adolescence is when you start with those secondary sex characteristics, which in girls is breast buds and boys is, the enlarged testicles. I mean, it's just part of what happens. We know that it starts with them all of a sudden becoming women and men and getting curves and growing tall. And it ends when they're more emotionally mature and they stop growing. Erickson, as I said, adolescence is a very confusing stage where they're really trying to establish their identity. Who am I? What do I want to be? My body image. All of those things are really important. They're starting to be more and more separated from the family. They're starting to have some intimacy of some type. And now they're figuring out, what do I want to be when I grow up? And then, of course, Freud is all about that psychosexual, it's called the genital stage. It's, the hormonal stage. It's boys and boys or girls and boys or whatever getting together and have those feelings, those hormones, as some people call it, but, experimenting. Piaget, as I said, they reflect abstract reasoning and logic, which means they can take something and try to figure it out. Like, how am I going to get out Saturday night when I'm not supposed to? The physical development seen in this age, it starts out with those beginning of sexual sex characteristics till they're completely grown up. Some of the primary problems and challenges of the adolescents is, all of a sudden they're rapidly growing. They want more of their privacy. They have all of these stresses because, you're with more people and, people tend to do things that not everybody likes. It could be your best friend doing something to hurt you, or, even mom and dad they just don't understand, right? But the thing about adolescence is trying to have good lifestyle choices so that there are not going to be any repercussions as they want to go on and go to school. One of the #1 hazards and kills many adolescents: firearms, right? Suicide, motor vehicles. So now the nursing process, we do an assessment. It means we look, we see, we collect information. And then we figure out, what do we need to do? And then the implementation. Well, we figured out the kid has a fever. We plan, we're going to take some of the clothes off and give some acetaminophen, and we're going to do it. And then we evaluate it. We go back and retake a temperature, right? Very simple. Now, the Denver 2 test, remember, this is not anything about intelligence. This is all just assessing to see if they need further evaluation for that fine or gross motor skills, okay? Timeouts, again, 1 minute per age is what they want to do. And then the BSA is actually the most accurate method for calculating appropriate doses for drugs. In the real world, you're just going to see milligrams, micrograms per kilogram, but the BSA is actually what the most accurate one is. And how are we going to be teaching sex education to adolescents? We can tell them to be abstinent. That's what they should be, right? Well, that's our opinion. We can't say that to them. What we can do is give oral and written information, just that information and not our opinions. So medications for children, we know it all has to do with the size of the child. With adults, what do? We take 2 Tylenol and give it to them, right? We don't do that in children. It all has to be looked. The absorption, distribution, metabolism, excretion, completely different in children. And then remember, older adults are the same. So it's sometimes we don't give those bigger doses because of the way it's metabolized and excreted. Children's reaction to drugs, we don't know as well as adults. And the one thing about kids, every kid reacts differently in every diagnosis and everything you do. There are no two the same. And that's what I've always loved about pediatrics, that they always challenged me. Weight measurements are in kilograms because of medicines, like as I said, milligrams per kilogram. IM injection for your young kids is vastus lateralis. It's better to put some numbing cream there so they don't remember that all the time, right? IM injections for the adolescents is ventrogluteal. You're not going to put it in their leg. You're going to put it ventrogluteal. That's the IM. I mean, you do deltoids for your sub-Q, but IM should be ventrogluteal. One of the things that has always been a concern with children is getting IV fluids. You know what's great today that I didn't have when I first started children? Every single child has an IV pump. Every adult has an IV pump to accurately monitor and make sure that there's not overloads of fluid going into children. I mean, if you have a child, an infant, who weighs 7 pounds, and all of a sudden you accidentally, infuse 300 mLs of fluid, they could be in congestive heart failure, right? So you have to be very careful. One of the things we recommend for good growth and development of infants is a pacifier. It is self-soothing. How do children explore the world? Infants, in the mouth, right? So you put a pacifier, they can suck and they can self-soothe. That's what's good about. And then how do we measure diapers? Intake, output. How do we know how much they urinated? Well, if a diaper, number one, weighs 30 grams, and you take a wet diaper, number one, of a child, and that weighed 60 grams, the difference between the wet and the dry diaper is 30 grams. That is 30 mLs of output. And it's very easily monitored that way. So another more things is, again, kilograms for their doses. How do you do kilograms? Well, if you have pounds, pounds are more than kilograms. So you divide by 2.2. Understanding your DHQs, how to give proper amounts of medicine for what dose. So do that and review that again. Tetracycline, why should it be avoided? Well, they get those gray teeth, right? Something that growing up, I knew a couple of girls had gray teeth growing up, and they had tetracycline. It never stops, right? Latchkey kid, I mentioned before, what is it? This is a kid who comes home by themselves, and they undo the door because mom isn't there yet, and there's no other choice. So they go inside, take care of what they want to take care of. But remember, there are so many risks of, even if they're cooking something, other people around, so there are risks involved, and it's something to be discussed with that child. Any questions?
I had a question, Ms. Bogart.
Sure.
Are we going to be doing BSA calculations? Because I seen you brought that up for